Good afternoon, ladies and gentlemen. Thanks for honoring the rendezvous with us on your #1 health program, You and Health, aired on Equinoxe Radio, multimedia. For presentation, I am Esia Luciliengu. It is one of the most leading diseases affecting women globally, including Cameroon, which causes pelvic pain, heavy menstrual bleeding, and infertility. You have sure guessed what we are talking about today. Today we'll be looking at fibroids on our health program. We're looking at the causes and also means of treatment. Why not a prevention which we can use in order to curb the disease across Cameroon? And before introducing our guests for the day, our special guest, I would like to introduce my co-host, Immaculate Fogi. Good afternoon.
Good afternoon to you, Lucy. Good afternoon to our listeners and televiewers, and also good afternoon to you, Doctor.
Thank you. And you already rightly said our guest for the day is already present here in the studio. Is no other person than Dr. TCHOKOTHE Léopold. Good afternoon, Doctor.
Good afternoon, Lucy.
It is a pleasure having you on Equinoxe today.
It's a pleasure mine too.
And without any transition, without any waste of time, we'll begin with the first question. We would like to know, to a layman understanding, what are fibroids, or what is fibroid?
Fibroid, as the name say, fibroid come from fiber tissue. It's a development of tumor that occur in the uterus. Uterus is the womb. So it's a disease that is very common in our society. And as I said earlier on, it's fibroid, also called leiomyoma or myoma. In French, some people will say fibrome and myome. So it's the same term, talking about the same pathology. So,
and just to mention that you are a gynecologist and also an obstetrician, what are some of the causes of these fibroids?
To point out the immediate cause of fibroid is not you cannot say it straightforward, because fibroid hypertension, it has predisposing factors. So we know that before the age of menarche, so the first menstruation, a lady cannot have fibroid. We also know that after menopause, ladies that don't have fibroids before cannot have it. So all those things that expose a lady to the hormones that control the menses can make the fibroids to occur. So one of the predisposing factor is that exposure to estrogens. Apart from that, we have the racial age, the races, because you notice that in America, for instance, when you have mixture of white and black, the black population has higher incidence than the white populations. And to come back to estrogen exposure, you have ladies that start seeing their menses early enough because you have long time to get exposed to the estrogens. You have ladies that see their menopause at very late, till very late in their late life. So because they were exposed to estrogen for a long time. Mothers that refuse to breastfeed. When you don't breastfeed, the menses come back earlier, so you are also exposed to estrogen for a long period of time. Besides all this, you have obesity. Obesity will cause hormonal imbalance, and that will favor the development of fibroid. We also have the age, female between 20 to 50, and also have the family history. So somebody that has a sister or a mother that had fibroid stand a chance to develop fibroid, but it's not that it can happen. So.
Before coming back to you, Doctor, let me read out the numbers in which you can call and participate in today's edition of the program, You and Your Health. Here are the numbers: 670-5470-49. I repeat, 670-5470-49 or 656-622222. 656-622222. Back to you, Doctor. Are all fibroids the same?
We can say yes and no. Yes, if you want to go by histology. Histology, that means the structure of that pathology. So if you get a piece of fibroid anywhere and you go analyze in the lab, you are going to see that structure, they are the same. But now, based on locations, so we don't want to say that the same, because on different locations you cause different complications and symptoms. Now, we have some fibroids that are located inside the endometrium. So this is the endometrium here. If you take the uterus, this is the uterus. So this is the cavity. So this place that's pinkish, we call it endometrium. Here you have the muscular layer, and then that side we have the serosa. So a fibroid that occur in this environment, we call it intracavitary fibroid because it's inside the cavity. Fibroid that's located beneath that pinkish area immediately, we call it submucosa because this is a mucosal layer of the uterus. Fibroid that's located in this environment, you can see this one, you call it intramural because inside the wall, you can call it wall mural in French, mural, intramural. So now the one that is located just under the covering of the uterus, we call it subserosa because that's the serosa covering the uterus. Now there's another fibroid that develop in the uterus but project itself into the abdomen. We call it pedunculated because it's held just by the stalk, so you can balance. So those are the type of fibroid we have. But for more understanding and treatment, FIGO, that's the Federal International of Gynecology and Obstetrician. International Fédération Internationale de Gynécologie et Obstétriciens, that's FIGO, International Association of Gynecologists. So they divided into FIGO 0 to FIGO 8. So from FIGO 0 to FIGO 3, those one are in contact with this place we call endometrium. FIGO 4 is just inside the muscular fiber. And FIGO 5 and 6 and 7 are just in contact with the serosa that covers the uterus. Now FIGO 8 is any other way. It can be into the round ligaments, the parametria, and also into the cervix.
Now, what are the symptoms to watch out for as far as fibroid is concerned?
As fibroid is concerned, the symptoms will vary from the locations and the size. As FIGO classification, that will help us to understand the symptoms. Fibroids are located beneath the submucosa. They will cause more of bleeding. Those that are located somewhere else, depending on the size now, they may cause signs of compressions. So if the ureter are compressed, we may have a urinary disturbance, frequency to urinate. You may have urinary abstinence if the ureter is really compressed. You may have compression posteriorly affecting the rectum, so that will lead to constipations. Those are the major symptoms you are going to have. Now, if the fibroid is also big enough, you may have sensation of heaviness in the lower abdomen, in the pelvis. And for those that are pedunculated, sometimes we hear some ladies say that I'm feeling as if baby is moving in my stomach. So because the fibroid pedunculated can move from one region to another, we feel some movement. So those are the symptoms you can have.
Okay. And now in our Cameroonian hospitals, which of these fibroids are more common? We have all of them that are common. Many ladies will come complaining of bleeding. Many others will come complaining of heaviness, and we have signs of compression in many of them. So all of them that are common. At what level should a woman be worried and maybe seek to visit the hospital?
Whenever you have discomfort, you have bleeding coming from your vagina, you have to seek for advice because those fibroids are always symptomatic and they need to be taken care of. Okay,
let's now break down how it is diagnosed.
Diagnosis of a fibroid is divided into two. We have to do physical examinations, and then we do laboratory investigations. On physical examination, you may discover the fibroid with a sign of complications like anemia. The patient we examine, we check the sclera is pale. So now we want to do abdominal examinations. You may feel a mass in the abdomen that is originating from the pelvis. And now, if you place a speculum, you may see blood coming from the cervix. Performing by manual examination, that is putting one finger in the birth canal and then another finger on the abdomen. If you move the uterus, you feel that the mass that is in the abdomen actually is moving with the finger in the birth canal. So as you are pushing, stimulate the uterus, is echoing on the hand on the abdomen. So we are sure from there that the mass is from the uterus. We can suspect fibroid because that's the major tumor in the uterus.
How can fibroids affect pregnancy?
Fibroid can affect pregnancy, and pregnancy also can affect fibroid.
Coming back to you, have a call on the line. Hello.
Good morning.
Good morning, madam. Your name, where you're calling from, and your question.
I'm calling from Sweden.
cribby, okay?
And so I have my daughter, she's on pain now. She said that all her two sides are paining her. Then right up the end. I don't know whether the doctor can give any idea about it.
That all her sides are paining?
Yes, all her two sides, the two sides of the stomach,
Yes.
under the abdomen. So she's feeling pain. She's unable to walk. That is, she's just burning.
She needs
So
to
that
go and consult, for sure.
She feels pains right down to her anus.
Okay.
So I don't know.
Thank you so much for participating in today's program. Have a lovely day. Doctor, you got that question right?
Yes, she says the daughter is pregnant.
No, that she's
No,
feeling pain.
that she's not pregnant, but she feels pains on her sides and on her abdomen.
Now, you know, in the abdomen and pelvis, they have many organs there, so it can be any other organs. It's better to go and consult so that they can do proper diagnosis.
Exactly. So, doctor, we're talking of how fibroids can possibly affect pregnancy.
Yes, so fibroid affect pregnancy. Pregnancy also affect fibroid.
Okay.
Yes, fibroid can prevent pregnancy from occurring. If the fibroid is big enough to obstruct the fallopian tube, the spermatozoa will not be able to move into the fallopian tube and meet the female egg, and no pregnancy will not occur. So even if the pregnancy occurs, the fibroid that's inside the cavity, as we said, it can be inside the cavity here. So that fibroid will just behave as a foreign body, even there's pregnancy.
We have another call on the line. We'll come back to you, doctor. Hello?
Hello?
Yes, madam. Good afternoon.
Good afternoon.
Your name, where you're calling from, and your question, please.
I'm Tarita.
Okay.
Calling from?
Calling from, turn off your receiver, please. Hello?
Hello?
Yes, madam. Go ahead with your question.
Okay, my question is, I want to ask the gynecologist on board, why is it that when they operate fibroid, it still grows again?
Okay. Thank you so much.
Thank you.
You got a question, doctor?
Yes, I got a question. She wants to know why the fibroid will recur after operation.
Exactly.
Yes, so sometimes it happens that you have multiple fibroids, so and then you operate it and it will recur. So the fibroid, when they are in the uterus, they can have many of them. There's a case that I did operation, I removed about 40 pieces of fibroids. Yes, they are not of the same size. So as you do the operation, there are some that are very small that you cannot see them. So after doing the operation, after some time, the one will still grow back if the female is still exposed to the estrogens and progesterone, those hormones that provoked the fibroid.
Okay.
Right, so doctor, tell us about the treatment options available.
Treatment options are available if the fibroid is asymptomatic. So we don't do anything because there's some fibroid that is asymptomatic. So if that's symptomatic, we can have surgery. Surgery may be open laparotomy, it may be laparoscopy, or it may be hysteroscopy. Apart from that, we can have radiology interventions, medical therapy also. So we abstain for fibroid that is symptomatic. As we said, fibroid that is symptomatic, we want to do open laparotomy, depending on the age of the patient and the desire to have children anymore. So we may have conservative therapy where we do mammectomy and keep it. But if ladies are of advanced age, we may want to do hysterectomy, because if the organ that is there has no other use, because the uterus is to carry the baby. So if we remove the uterus, there's no harm for that patient. Rather, we are helping her for preventing cancer of the cervix. We can do hysterectomy. Medical therapy is more for those fibroids that we want to decide to reduce, and then operation later, also to alleviate the symptoms. Because by giving medical therapy, you still have to do operation if the menopause are not come, the patient is still exposed to the estrogens. And then laparoscopy surgery, those many times is for fibroids that are found incidentally, and then laparoscopy is intervention that we do without opening the abdomen. You put a prop in the abdomen like camera, and then we use forceps to do the operation without opening the abdomen. Also, hysteroscopy, if the fibroid is inside the cavity and the size is small, you do hysteroscopy for those type of fibroid without opening the abdomen.
All right, doctor, due to time, any last words for our viewers and listeners out there?
What I would say is that the fibroid is a very common disease, and whenever the symptom has started occurring, you have to pay a visit to to a doctor for the proper care to be taken. Fibroid is there every day. I haven't operated one before coming here this morning.
Wow.
So.
All right, thank you very much, Dr. CHOKOTHE Léopold. You are a gynecologist. Thank you for accepting to be our guest on today's edition.
Thank you for giving me the opportunity to talk with the public.
We hope to have you here next time again.
Sure.
Immaculate Fogwe, thank you.
It's always a pleasure being here, Lucy.
Thank you, ladies and gentlemen, for staying faithful to Equinoxe Television and Radio. For presentation, I have been Lucy Liengu. Technically assisted by Jonathan Babiola and Louis Pego. Do stay in the company of interesting programs. Bye-bye for now.